Okay, our group did cognitive impairments.
A cognitive impairment is when a person has trouble remembering, learning new things, concentrating, or making decisions that affect their everyday life. The main symptom is difficulty thinking and understanding, and the life skills that can be impacted include certain conceptual, social, and practical skills. There are 4 levels, and the levels are mild, moderate, severe, and profound.
What is an intellectual disability? A term when someone's ability to function in everyday life is limited. They can even have a hard time expressing their needs to someone else. An intellectual disability can be something that develops between birth and the age of 18. It can be caused by an injury, disease, or other problem in the brain. Most causes are never discovered. The most common known causes of intellectual disabilities are Down syndrome, fetal alcohol syndrome, Fragile X syndrome, genetic conditions, birth defects, and infections that happen before birth. The signs that there is an intellectual disability is they sit up, crawl, or walk later than normal. They learn to talk later or have trouble speaking, find it hard to remember things, have trouble understanding social rules, have trouble seeing the results of their actions, and have trouble solving problems.
Some national organizations that kind of help and research about all these things. Some of them are Medline Plus, which highlights mild cognitive impairments. This includes losing things often, forgetting events and appointments, and having more trouble coming up with words than other people of the same age. Another one is National Organization for Rare Disorders, highlights Prader-Willi syndrome. This is a genetic multi-system disorder characterized during infancy by lethargy, diminishes muscle tone, feeding difficulties with poor weight gain and growth. They also highlight mixed cognitive tissue disease. This is an uncommon systematic inflammatory rheumatic disease. And then Association of University Centers on Disabilities. This is a network of interdisciplinary centers advancing policy and practice for individuals with developmental and other disabilities, as well as their families and community.
More national organizations are the Division on Developmental Disabilities, a professional organization full of educators, therapists, direct service providers, educators, family members, and others who provide support and services to those individuals with cognitive disabilities. Another one is the International Association for the Scientific Study of Intellectual Disabilities. This was founded in 1964. It is the first and only worldwide group that is dedicated to scientific study of intellectual disability. It is an international, interdisciplinary, and scientific non-governmental organization that promotes research and exchange of information on intellectual disabilities. Another one is TASH, Equity, Opportunity, and Inclusion for People with Disabilities. They work to advance inclusive communities through advocacy, research, professional development, policy, information, and resources. The ARC, devoted to those with mental retardation and developmental disabilities and their families to promote and improve supports and services.
Government websites that go into deeper understandings of development, delay and development is the Idaho Health and Welfare, Medline Plus, and Center for Disease Control and Prevention, CDC. Idaho Health and Welfare provided that it has a program called the Idaho Developmental Disabilities Program. They have a chronic disability which appears before 20 years of age is kind of their definition of development. The Department of Health and Welfare can help provide a number of services to assist adults and children with developmental disabilities, such as physical and occupational therapy, housing and living supports, chores and services, employment support, environmental modifications, home-delivered meals, nursing services, respite care, habilitative supports, family education, crisis intervention, and in-school supports. And the Medline Plus website, it just defines the developmental disabilities. It says it may be physical, such as blindness. It may affect mental ability, such as learning disabilities. The problem can be both physical and mental, such as Down syndrome. The problems are usually lifelong and can affect everyday living. Some causes are genetic or chromosome abnormalities, prenatal exposure to substances, certain infections in pregnancy, and preterm birth. The Center for Disease Control and Prevention, also known as CDC, showed the developmental monitoring and screening. The developmental monitoring is your child's development is a journey. Monitoring and screening show you the way. Who would be you and your parents, grandparents, and other caregivers? The what is look for developmental milestones. The when, from birth to 5 years. The why, to help you celebrate your child's development. Talk about your child's progress with doctors and child care providers. Learn what to expect next. Identify any concerns early. How is with easy free checklist that they have online, which is super helpful. And then developmental screening. The who is healthcare provider, early childhood teacher, or other trained provider. The what, look for developmental milestones. The when, at 9, 18, and 24 or 30 months, or whenever there is a concern. The why, to find out if your child needs more help with development, because it is not always obvious to doctors, child care providers, or parents if a developmental evaluation is recommended. The how is with the formal validated screening tool. And just a fun fact to end is about 1 in 6 children in the US have one or more developmental disabilities or other developmental delays.
Okay, and so I read a case study on a study of attitudes of those helping with different Special Olympics. And so first off, the article talked about how 3% of the world's population has intellectual disabilities. In the past few decades, globally, there's been a bigger stride to include those with disabilities. Females generally show a more positive attitude towards those with intellectual disabilities. People who had less knowledge on disabilities demonstrated a more negative attitude towards those with cognitive disabilities. And students who major in rehabilitation or social work tended to be closer with those who have intellectual disabilities. Different courses that people take can really help shape their perspective and attitude. So the first Special Olympic was held in 1968, and this was an opportunity for those who had disabilities as well as those who didn't have disabilities to come together. There's a study done in which they had the volunteers who were ages 18 to 25, and these students were studying something other than what had to do with anything with special needs. And so their goal was to try and see how these students, how they would act and what their attitudes would be throughout the course of the Special Olympics towards these students. And so it was kind of evaluated that the female's attitude was greater than the male's over the course of the time, but that the attitudes of the people did generally improve throughout the whole.
Okay, that is our presentation on cognitive impairments.